Dr. Amit, you can start with the introduction.
Yes. So, am I audible, sir?
Yes, you are audible, sir.
Yes, you're audible.
Good morning to all the delegates. We are fortunate to have Dr. Sitaram Gupta as a resource person for today's lecture in the 21 days National Refresher course on the current developments in veterinary and fishery sciences, jointly organized by the Rajwas, Kufos and NDTCL. So, welcome you all participant and the resource person also. First of all, before the starting the presentation, I would like to take a brief introduction of the resource person. So, Dr. Sitaram Gupta, he the senior assistant professor in Department of Veterinary Medicine and also bearing the charge of the officer in charge of Department of Medicine and Medicine of College of Veterinary Animal Science, Rajwa, Bikaner. So Dr. Sitaram Gupta has also, before the recruitment at this university, Dr. Sitaram Gupta has worked for the worked as assistant professor in the Apollo Veterinary College, Jaipur, and thereafter he has also worked for as assistant professor in livestock station, Cordon Blesser, CVS Rajwas, Bikaner, and now presently he is working as the officer in charge and senior assistant professor in Department of Veterinary Medicine. So as far as the academic career is concerned, Dr. Gupta has got the Best Oral and Poster Presentation Award in Veterinary Internal and Preventive Medicine Appreciation Award and Best Clinician Award during the year 2024. He has also published 70 research papers in national and international reputed journals, and he is also the life member of the 10 different technical and professional societies and journals. He has also guided the 6 MBA students as a major guide. So after a brief intro, I would like to welcome Dr. Sitaram Gupta for today's lecture and also request to start his presentation and address the delegates, sir. Over to Dr. Sitaram Gupta, sir.
Thank you, Dr. Amit, for nicely presenting and introduce to participant and other organizing member of this webinar. Today topic of webinar is the significance of electrocardiography in the clinical diagnosis of the cardiac diseases in the canine. As all are know, there are the various diagnostic modality are available for diagnosis of the various diseases. In routine clinical practice, we perform the fecal examination, urine examination, blood count, CBC, complete blood count, and blood film smear method for diagnosis of the various hematoprotozoal diseases. And apart from these basic principles, there are the various specific diagnostic procedures are also available in the veterinary practice to diagnose the various diseases of the animals, like a CT scan method, MRI, USG, and electrocardiography. So these various diagnostic procedures are using in the diagnosis of the various clinical diseases of the animals, mainly depend on that what animal species are involved and type of diseases and part of the organ or system are investigating the for the diagnosis. So when we talk about the diseases of the cardiovascular disorders, so ECG is the important role in the diagnosis of the cardiovascular diseases, as ECG provide a additional window to see inside the thoracic cavity in the form of electrical activity which is happening during the one cardiac cycle in the heart. And this electrical this window may provide the various abnormality which is happening in the heart. So the electrocardiography is the very important diagnostic modality for diagnosis of the cardiovascular diseases in the animal. As we know that the leading cause of morbidity and mortality in the small animal is the cardiovascular disorder. So in this webinar, or in this slide shows, I try to convey my message to how to interpret the ECG in the daily clinical practice. And I hope that at the end of this webinar, all the participants should be gain enough confidence to apply ECG in daily clinical practice. So now, what are the electrocardiography? And this electrocardiography generally formed by the three terms. First one is the electrocardiograph, second one is the electrocardiogram, and third one is the electrocardiography. So first one is the electrocardiograph. It is nothing. It is a machine which measure the potential difference or electrical activity of the heart between the two electrodes. Two electrode means there is the electrical activity of the heart between the positive or negative electrode. And second term is the electrocardiogram. This is the graphical representation of the electrical activity which is going on in the heart during the one cardiac cycle. Means what are the electrical activity happen in the heart during the depolarization or repolarization. And last one is the electrocardiography. Means it is a procedure. It is a procedure by producing the electrocardiogram and by using the electrocardiography machine. So electrocardiography, it is a electrical event which is happening in the heart, which is this electrical event recorded in the graph paper or ECG paper by the help of machine. So this is the electrocardiography. This is a procedure. Now there are the indication of the electrocardiography. As we know that there are the various conditions in which electrocardiography help in the diagnosis of the disease. Out of these, first one is the evaluation of the PEG for gasping, fainting, dyspnea, exercise intolerance. And ECG also help in evaluation of the various arrhythmias, cardiac enlargement. There may be either atrial enlargement or either ventricular enlargement. There also be rule out by the ECG by the conduction abnormality of the heart. And there are the various inflammatory conditions of the heart like the pericarditis. This also will help in the monitoring of the cardiac functions during the anesthesia or after surgery. We can be used the ECG in acute emergencies and intensive care units. And also we help, apart from the cardiovascular disorders, ECG may also be help to evaluate the electrolyte imbalance. Either there may be hypokalemic stage or hyperkalemic stage, or hypocalcemia or hyperkalemia. ECG also help in the monitoring of the medication. Now, what are the preliminary requirement for the electrocardiography? So this is the not so much specific requirement for recording of the ECG. The total 5 requirement is required for the electrocardiography. First one is the ECG machine with lead and ECG gel or spirit. This ECG gel or spirit is put on the before the clipping to remove the hair, remove the air which is trapped between the hairs, and ECG roll and cotton. And there are the standard color coding which use for the particular limbs. So red color indicate the lead for the right forelimbs, and yellow color indicate for the left forelimb, green color indicate for the left hind limb, and black color indicate for the right hind limb, and white lead is placed on the chest. Now, lead system. There are the mainly 4 lead system, but in canine and feline, we mostly use the valet, hexaxial lead system. This ballet hexaxial lead system is composed of two types of lead system. First one is the bipolar lead system, and second one is the unipolar augmented lead system. In lead system, there is nothing. The lead act as a electrode, and this measure the potential difference between the two limbs. In case of bipolar standard lead system, this bipolar standard lead system has the three leads designated as a lead 1, lead 2, lead second, and this lead 1 measure the potential difference between the right arm and the left arm, and lead second measure the potential difference between the right arm and the left leg, and lead third measure the potential difference between the left arm and the left leg. An augmented unipolar lead system. In this lead system, the three lead also be contained in this lead system, and these lead system are designated as AVR, AVL, and AVF. A stand for the augmented, B stand for the vector, and R, L, F stand for the right arm, and left leg. And in this lead system also, they measure the potential difference between the reference lead, or at the electrical sum of the electrical activity of the remaining two leads. So ABR measure the potential difference of the right arm and compare the left arm and left leg, and AVL compare the electrical potential between the left arm with the right arm and left leg, and lead ABF measure the potential difference between the left leg and compare with the right arm and left arm. In this lead system, right arm, and left leg act as a reference lead, and other two leads are some of the electrical event are measured on the average level. So now preparation of the animal for ECG. So not so much specific requirement, no specific requirement is required to record the ECG. Simply put the animal in lateral recumbency on the insulating table and remove all the metals which is present all over the body of the animal. There is no requirement of the chemical restraining during the taking of the ECG. There is the requirement of the trained attendant on animal owner. And one should precautions should be kept in the mind while recording the ECG. The animal should be keep and quiet and calm. If the animal is violent, then there may be artifact may be present in the ECG. So after placing the animal, what are the normal position of the leads? So in case of forelimb, both the forelimb, the lead may be placed at the flexor angle of the elbow. Means the picture shows the this is the elbow of the animal. So in case of hind limb, the lead may be placed on the flexor angle of the stifle joint or hog joint. If we are placing the precordial lead or chest lead, then the white color lead may be placed on the fifth right intercostal space. Now this is the pictorial presentation of the placement of the leads in the hind limb. In first picture, this is the hog joint in all the four pictures. Now this is the normal conduction system. This slide shows the how electrical impulse is spread all over the heart. So in this picture, the electrical impulse is generated at the level of SA node. So this SA node is the pacemaker of the heart. From SA node, the electrical impulse is spread all over the atria, and after spreading the electrical impulse all over the atria, then this electrical impulse goes to AV node, and this is the AV node. And electrical impulse reach to AV node by the internodal pathway. And after reaching the electrical impulse at the place of AV node, this electrical impulse is spread all over the ventricle by the bundle of his. This is the bundle of his, and after that, this is the left bundle branch and right bundle branch and Purkinje fiber. This is the normal pathway of the electrical impulse. So first electrical impulse is generated at the AC node, then goes to atria, then goes to AB node by the internodal pathway, then goes to ventricle by the bundle of his, left bundle branch below left. Electrical impulse is spread all over the heart. During the spreading, there are the various waves, segment and interval are formed. And this electrical impulse, which is generated from atria to ventricle, are recorded on the ECG paper in the form of waves, segments, and interval. So in one cardiac cycles, 3 waves are recorded: P waves, QRS complex, and T waves. P waves represent the atrial depolarization, QRS complex represent the ventricular depolarization, and T wave represent the ventricular repolarization. And 2 segments also may be recorded in the ECG. First one is the PR segment, and second one is the ST segment. In PR segment, all the segments are the present on the isoelectric line. So PR segment indicate the present the between the 2 waves. So in PR segment, start from the end of the P wave and at the start of Q wave or QRS complex. And ST segment is start at the end of S wave to end start of the T wave. And this segment present on the isoelectric line. And 2 are interval, which also be recorded in the ECG graph paper, the PR interval and QT interval. The interval comprises of the waves or segment. It includes the one segment and one or more waves. In case of PR segment, it is interval, PR interval, it is start from the P wave and from the starting of the QRS complex. And QT interval, it is start from the QRS complex to end of the T wave. So in normal condition, the P wave duration is the 2 small box and amplitude is up to 4 small box. And QRS complex, the duration of the QRS complex not more than 3 small box. And amplitude of the R wave is depend on the animal species. And normally it ranges from the 2.5 millivolts to 3 millivolt. And PR interval, it indicate the atrial activity, and QT interval represent the ventricular activity, means there is the ventricular depolarization and ventricular repolarization. PR interval not more than 5 small box or 1 large box. And QT interval is mainly depend on the heart rate. This is the ECG paper. Before going in the detail in the subsequent slide, we should know about what is the ECG paper. And in ECG paper, there are the various large boxes, and each large box contain the 5 small boxes. So when we are recording the ECG in a dog, we should know about what is the sensitivity of the ECG machine and what is the speed of the ECG machine, because all the data which is recorded in the ECG, which mainly depend on the sensitivity or speed of the electrograph or electrocardiographic machine. So on the basis of speed of the 25 millimeter per second, means the 5 large box in 1 second. On the basis of speed, the one large box, the speed of one large box is the 0.2 second, and one small box indicate the 0.4 second in the x-axis. And sensitivity or amplitude is measured on the y-axis, and this represent the 10 small box or 2 large box equal to 1 millivolt. So on that basis, one small box represent 0.1 millivolt and 1 millimeter. So it is clear to all, because all the data in subsequently slide or be measured on that basis. So speed is 25 millimeter per second, means the one large box indicate the 0.2 second, and one small box represent the 0.04 second. This is on the x-axis, and y-axis this represent the amplitude of the ECG, and in 10 millimeter per millivolt indicate the one small box is represent the 0.1 millivolt. So this is the normal electrocardiographic value in the healthy dog. Heart rate is 70 to 170 beat per minute in a small dog or a small breed, 80 to 170 in large breed, 70 to 160, and puppies 200 to 220. The now P amplitude, it is up to 0.4 millivolt, means the maximum amplitude is the 4 small box. The P duration means this is the on the x-axis. This represent normally it is the 0.02 to 0.04. R amplitude in the small breed 0.9 to 2.4 millivolt, and large breed 1.2 to 2.8 millivolt, and QRS complex in average not more than the 3 small box, and T amplitude almost same as the P amplitude, but increase in the 0.1 millivolt, and duration just double the P duration, and PR interval 0.08 to 1.2, and ST segment, this is the baseline, and so this is present on the isoelectric line. There may be any depression and any elevation indicate the myocardial infarction and myocardial injury, and QT interval and RR interval represent the 0.11 and 0.23 seconds. This are both are depend on the heart rate, and this is the mean electrical axis. In case of dog, it is plus 42 plus 100 degree. So what information get from the ECG? In ECG, we can be determine the heart rate, rhythm, rate. We can also be measure the complex measurement by measuring the amplitude and duration of the different waves, and we can be measure the mean electrical axis of the heart. Mean electrical axis of the heart, this is the net direction of the electrical activity in the heart, which is happening in the heart, and different kind of cardiac arrhythmias. So there are the 6 steps for interpretation of the ECG. While we are getting the ECG in front of your table or your clinics, then how to interpret the ECG? For interpretation of the ECG, we follow these 6 steps. If we follow these 6 steps, then never we miss the any wave or any segment or any interval and reach to our interpretation. So first, see the ECG for the regularity. The rhythm is regular or irregular. After measuring the regularity, we load the heart rate, and it is the normal or abnormal. Abnormal means either there is the bradycardia or either there is the tachycardia. After measuring the regularity and heart rate, then after that we saw the different morphology of the P wave and QRS complex, and duration of the P wave and QRS complex. If when we see the P wave, then see the there is the presence of the absent of the P wave. If there is the present of the P wave, then this P wave is the normal or abnormal. And after seeing the P wave, we measure the PR interval. After in PR interval, we measure the PR interval. This is the constant in the each and every cardiac cycle. If there is the variation in the cardiac cycle, this is the continuously increasing or continuously constant of the PR interval. And after that, we saw the QRS complex. QRS complex means this is the normal or abnormal. On the abnormal means the normal QRS complex means is the sharp, steep line and steep angle. On abnormal means there is the wide bizarre shape QRS complex. And after the seeing all these parameters, we interpreted the ECG. Either this is the sinus rhythm, or there may be any sinus arrhythmia or any other things. So come on the first ECG interpretation. First is the calculation of the heart rate. Before calculating the heart rate, we should examine the ECG for the rhythm. If the rhythm is regular or irregular. If rhythm is regular, then there is the different method, and rhythm is irregular, then different method. So first examine the ECG for the rhythm. If the rhythm is regular, then use the large box method or 300 method or 1500 method. 300 method and 1500 method is the same, because as discussed in the previous slide, one large box contained the 5 small box. So 300 method is equal to 1500 method, because 300 is the large box and 1500 is the small box. In case how to calculate the heart rate in regular rhythm, for determination of the heart rate, we should count the number of large boxes between two R wave. Large boxes between the two R wave, or calculate, we can also calculate the small box between the two R wave. When we are calculating the large box, then 300 divided by the number of large boxes. And this data come after dividing the number of large boxes. This is the heart rate per minute. If we divide the 1500 by the number of small boxes, then this is also give the heart rate. If the rhythm is irregular, then use the 3 second or 6 second method. In 3 second method means we examine the strip of the 3 second. In 6 second, we examine the strip for the 6 second. 3 second method means we calculate the heart rate in 1 minute. So 3 second means it is multiplied by the 20. If we using the 6 second method, then it is multiplied by the 10. And after calculating this factor, we measure the number of large boxes between the 3 second or 6 second. As if the speed is 25 millimeter per second, it indicates there is the 15 large box between the 3 second, because in 1 second there is the 3 large box at the speed of the 25 millimeter per second. If the speed of the ECG is the 50 millimeter per second, means it indicate it cover the 10 large boxes in the 1 second. So in 3 second method, 30 large boxes counted. For calculation of the heart rate in the rhythm irregular, the number of QRS complex in the 3 second or number of QRS complex in the 6 second and multiply by the 20 or 10 respectively in case of 3 second method or 6 second method. Means in nutshell, we identified the 15 large box in the ECG strip, and after identifying the 15 large box in the ECG, then calculate between these 15 large box, count the number of QRS complex between these 15 large box. And this is the ECG presentation. In first ECG, there is the number of large box almost 3. So heart rate is approximately 300 divided by 3. This is the 100. And in this slide, this is the number of boxes, large boxes between the two R wave is the approximately 10. So this heart rate is the 30. In third ECG, the number of large boxes between the number of the large boxes between the two R wave is the 1, only 1. So the heart rate is the 300. This is clear, I think. Now, there are by the ECG, we can be measure the abnormality of the T wave and QRS complex and T wave. As discussed in the normal parameter, the duration of the P wave is 2 small box, means when duration is the 0.08. So if the duration is increased or broad, then this indicates the left atrial enlargement. If the amplitude is more than 0.4 millivolt, it indicates the right atrial enlargement. If the P wave is tall and broad, means there is the bilateral atrial enlargement. So in lower, this first ECG recording is indicate the increased amplitude of the P wave. This is the increased amplitude of the P wave indicate the right atrial enlargement. And in this ECG, this is the broad P wave. And this broad P wave indicate the left atrial enlargement. And abnormality in the QRS complex, as discussed in the earlier, the amplitude, normal QRS complex amplitude of the R wave is 2.5 millivolt to 3 millivolt. If the amplitude of R wave is more than 2.5 millivolt or 3 millivolt, indicate the left ventricular enlargement of left ventral branch flow. As discussed in the earlier, the normal QRS complex not more than the 3 small box. 3 small box means, so if there is the wide QRS complex, this is also indicate the LVE or LVVV. And after that, if there is the deep S wave or deep Q wave, this indicate the right ventricular enlargement or RVE or RVVB. The Q wave is the first negative deflection in the QRS complex, and R is the first positive deflection after the QRS complex, and S wave, this is the after the R wave, this is the S wave, the R wave followed by the S wave. So this is the ECG presentation of the cardiac enlargement or particularly ventricular enlargement, as the first ECG showing the deep S wave. This deep S wave indicate the right ventricular enlargement. And this is the deep Q wave. Generally, the Q wave is the less than 1 small box. When this is the deep Q wave indicate is the more than 1 small box. And this deep Q wave indicate the right ventricular enlargement. Now, mean electrical axis. What is the importance of the mean electrical axis? Because this provides the net direction of the electrical activity of the heart during the depolarization wave through the ventricle. So in normal condition, the heart is directed toward the left side, and the normal mean electrical axis of the heart is the plus 40 to 100 degree. If there is the deviation from the 40 between the 14 to 100, then this cause the axis deviation. If there is the less than 40 to minus 19, it indicate the left axis deviation. It more than 100 to minus 19, it indicate the right axis deviation. This is the presentation by which the axial showing the electrical axis in the dog, and in this green area is showing the normal electrical axis of the dog. In second picture, this green area showing the normal electrical axis of the cat. Now, how to calculate the mean electrical axis in the ECG? For there are various methods. In method 1, first we select the smallest lead of the smallest amplitude. If we are seeing the ECG, then we see the lead which showing the smallest amplitude, means near the isoelectric line. After selecting the smallest amplitude lead, then make a perpendicular line from the center. And this perpendicular line from the center indicate the mean electrical axis of the heart. And in second method, in this method, we first measure the net amplitude of the QRS complex in the lead 1 and lead 3rd. And this is the lead 1 and this is the lead 3rd. After measuring the net amplitude of the QRS complex, we put the data of the net amplitude of the QRS complex in the lead 1 and lead 3rd. And after putting the data of the net QRS complex, make a perpendicular line on that lead 1 and that lead 3rd up to that level at which both the perpendicular line intersect. And after that point where both the line intersect, this point is showing the mean electrical axis of the heart. But these two methods are very cumbersome and required calculation of the QRS complex. So in another method this is the very simple method. In this method, we examine the QRS complex in the lead 1 and lead ABF. In the first ECG, showing the 6 lead 1, lead 2, lead 3, and lead AVR, AVL, and AVF. So to determine the axis, we examine the QRS complex of the lead 1 and lead ABF. In normal electrical axis, we see the QRS complex in lead 1. This is the positive QRS complex, and this in ABF, this is the positive QRS complex. In normal axis, both the QRS complexes are the positive direction and the same direction. So to determine the mean electrical axis, this one is the mnemonic, which is known as the right reaches and left leave. Means if the QRS complex in the lead 1 and lead ABF reach to each other, this indicate the right axis deviation. If the QRS complex of the lead 1 and lead ABF is leaving to each other, this shows the left axis deviation. So in second ECG, we see the QRS complex of the lead 1. In lead 1, the QRS complex is positive. And lead ABF, the QRS complex is the negative. So both are leaving to each other. Though in left axis deviation, the QRS complex never meet because the direction of the both QRS complex in the opposite direction. So this ECG this ECG is the left axis deviation. In this ECG, the QRS complex of the lead 1 is the negative direction, and QRS complex in the ABF is the positive direction. Means both the QRS complex may be meet to each other. So this represents the right atrial deviation. Now come on, the important topic is the arrhythmia. What is the arrhythmia? As you know that there is the sequence of event which is happening during the one cardiac cycle. If these sequence is repeated at the regular interval, if these sequence of event is not happening at the regular interval, then this condition is known as arrhythmia. So arrhythmia, there may be abnormality in the rate, and there may be abnormality in the site of the origin, or there may be abnormality in the conduction of the impulse. So on that basis, arrhythmia may be classified by the different base. So there is this slide shows the classification of the arrhythmias. In first, normal sinus rhythm. Normal sinus rhythm, this indicates the electrical impulse is generated from the AC node, then AB node by the internodal pathway, and bundle of his left bundle branch and right bundle branch, and Purkinje fiber. In normal sinus rhythm, how to examine this? The strip is the normal sinus rhythm. So in normal sinus rhythm, the conduction, the electrical impulse is spread all over the heart by the normal pathway. And when there is the conduction occur in the normal pathway, then each cardiac cycle has the P wave, and P wave is married to QRS complex, and this QRS complex is followed by the T wave. If this pattern is found in the ECG, then this is the normal sinus rhythm. If there is the abnormality in the speed, then this disturbance is known as, this type of arrhythmia known as, either there may be sinus bradycardia or there may be sinus tachycardia. This is the one way. If there is the abnormality in the disturbance of the site, means there is the apart from AC node, electrical impulse may also be generated other than the AC node, as the each and every cell has capacity to generate the electrical impulse. If the AC node is not working properly, then AB node take the charge of AC node. If AB node is not working properly, the bundle of his take the charge of AB node, and same followed by that. If the bundle of is not working, then bundle branch, left or right bundle branch take the charge, and if both are fail to conduct the impulse, then the ventricular muscles may also be generate the impulse. So in disturbance in the origin, the arrhythmia may be divided into two types. First one is the atrial rhythm, means, or supraventricular impulse formation, means there is the site of origin is the above the ventricle. So that's why reason this type of atrial rhythm is also known as the supraventricular impulse formation. On that basis, this supraventricular arrhythmia may also be classified as the atrial premature complex or premature atrial complex, or in short form be known as the APC or PAC, atrial tachycardia, atrial fibrillation. If the site is present on the ventricular region, then the arrhythmia is known as ventricular arrhythmia. And this also be three type: ventricular premature complex, ventricular tachycardia, ventricular fibrillation. And third and last type of the arrhythmia is the delayed conduction, means the conduction is going from the atria to ventricular, but the time is delayed. So on the basis of delayed conduction, this is first degree AV block, second degree AV block, and third degree AV block. And now discuss in the detail. This one is the sinus rhythm. Sinus rhythm means all the electrical impulse generate from the AC node, and this is the one cardiac cycle, and this is the one cardiac cycle, and this one cardiac cycle indicate this is the P wave, this is the QRS complex, and this is the T wave. If the P wave is married to QRS complex, and this QRS complex is followed by the T wave, means this is the sinus rhythm. Now, sinus bradycardia means rhythm is sinus. Sinus bradycardia means there is the abnormality in the heart rate, but all the impulse is generated at the SA node. So in sinus bradycardia, ECG has normal PRS, P wave, QRS complex, and T wave. But the number of large boxes between the two R wave is large. So this is the bradycardia. In sinus tachycardia, as discussed in the bradycardia, sinus bradycardia, this is also has the P wave, QRS complex, and T wave. And presence in these sequence is indicate this is the sinus in origin. And tachycardia indicate means number of large box between two R wave is less. If there is the number of large box between two R wave, this indicate the sinus tachycardia. If the number of large box between two R wave is more, this indicate the sinus bradycardia. If there is the number of large box between the two R wave, this indicate the sinus tachycardia. Now, second one is this is the disturbance in the site of impulse formation. And this is the supraventricular impulse, means the impulse is generated from the atria apart from the SA node. SA node also generating the impulse. Apart from SA node, some ectopic foci may be present at the atrial site. So this ectopic foci also we generate the electrical impulse. Or in case of APC, sometimes this atrial ectopic foci counter the impulse of the SA node. When the ectopic foci counter the SA node impulse, then this abnormality in the ECG is found in the form of different morphology of the P wave. And some different morphology of the P wave present in the ECG. This indicate the atrial rhythm or supraventricular arrhythmia. Any kind of different morphology of the P wave present in the ECG indicate the supraventricular arrhythmia. On the pattern of different morphology of the P wave, the APC may be bigeminal APC, trigeminal APC, and quadrigeminal APC. Bigeminal APC, this indicate the every alternate P wave is APC, means every alternate P wave has the different morphology. In trigeminal APC, this indicate the every third P wave has the different morphology. In quadrigeminal APC means every fourth P wave has the different morphology. And now see the ECG presentation. In case of bigeminal APC means the one P wave has the different morphology. So see this ECG, this is the normal P wave, QRS complex, T wave. This has the different morphology. Similarly, this is the normal, this is the different morphology. So an alternate P wave has the different morphology. Now trigeminal means every third heartbeat or third P wave is the abnormal. So this is the normal P wave, this is the normal P wave, and this is the third P wave which has the different morphology. And similar pattern, this is the normal P wave, this is the normal P wave, 1 or 2, and third is the abnormal P wave. So this is the trigeminal. And this is the 1, 2, 3. This is the positive P wave. This has the negative P wave. This is the different morphology and different presentation of the P wave. So this is known as the quadrilateral APC. Same pattern may be present in further ECG. This is the 1, 2, 3, and this is the negative and abnormal morphology. 1, 2, 3, and this is the fourth. Now, atrial flutter, as discussed in the earlier slide, all supraventricular arrhythmias origin due to ectopic foci present in the atrial side. So in case of atrial flutter, in this atrial flutter, large size of the ectopic foci in the atria, and due to large foci present in the atria, the electrical impulse generate from this ectopic foci and re-enter in the again and again on the this ectopic foci. So there may be rapidly regular atrial tachycardia may be present in the this type of animal, and the heart rate is more than 300 to 400. To circus re-entry phenomena, there is the excessive stimulation of the atria. So there is the no synchronization between the atria and ventricle. And in this condition, due to rapid regular atrial tachycardia, in this type of ECG, there is the not present of the P wave. Apart from the P wave, these are the present of the F wave. And in the slide, these F wave look like a short tooth appearance in the ECG. And seeing the ECG, this is the P wave and this is the QRS complex. And due to rapid regular atrial tachycardia, this is the number of F wave. This is the not a P wave. This is known as the F wave. And these are the F wave. These are the F wave. And this ECG look like the sawtooth appearance. While investigating the ECG for the atrial flutter, then examine the ECG by the reverse, reverse the ECG. When we reverse the ECG, then this ECG almost look like the sawtooth. So this is the reverse ECG, and this clearly show the like a sawtooth appearance. And after that, this is the atrial fibrillation. In atrial flutter, there is the large size ectopic foci present in the atria. In case of atrial fibrillation, there is the number of ectopic foci present in the atrial side. So each and every ectopic foci has capacity to initiate the electrical impulse. So in this condition, there is the chaotic and very rapidly or irregular atrial tachycardia. In this condition, the heart rate is more than 300 to 600 per beat. And these multiple ectopic foci present in the atrial side may contract the very fast, and these atrial contraction not synchronized with the ventricular contraction. So when we examine the animal by the by physical method, then there is the normal pulse. Cannot be examined, cannot be differentiate by the this is the atrial fibrillation or normal. When we examine the pulse by the femoral artery and femoral artery, if when we put the stethoscope on the chest region, there is the severe tachycardia. So this difference of the heart rate by the physical examination or by the stethoscope method is the denoted by the pulse deficit. So this pulse deficit is the important clinical finding of the atrial fibrillation. And in this type of ECG also there is the not present in the P wave, and the presence of the P wave not present of the P wave and wave present on the ECG between the QRS complex is known as the fibrillary wave. These are the ECG presentation of the atrial fibrillation. This is the small number of P wave. In this condition, the atria is like a seizing, and this is the fibrillary waves. And this is the between the R wave. R wave is the rhythm is irregular. So this is the irregular rhythm and has the number of fibrillary wave between the two R waves. Now, second type of disturbance of ventricular arrhythmias. As discussed in the supraventricular arrhythmias, these ectopic foci may be present in the atrial side. In case of ventricular arrhythmias, these ectopic foci present in the ventricular muscles. So as discussed, each and every muscles of the heart has capacity to initiate the electrical impulse. So if SA node is does not working properly, then AB node is generated. If AB node is not working properly, then bundle of his. Then if bundle of is not working, then left bundle branch, right bundle branch, then Purkinje fiber, and after that ventricular muscles. So in case of ventricular premature complex, the similar way, the ectopic foci present in the ventricle, and this ventricle ectopic foci which is present on the ventricle may also be initiate the electrical impulse. So there is the different morphology of the QRS complex between the normal sinus rhythm is indicate the ventricular premature complex. So this is the normal PRS complex, and this abnormal wide or bizarre shape QRS complex, this indicate the BPC. In BPC, there is the one ectopic foci which is present on the ventricular muscles. So if there is the any ECG showing the large bizarre shape QRS complex, then this indicate the BPC. In ventricular tachycardia, this is nothing. This is same as the BPC. If there is the in ECG, if there is the more than three or more BPC present in continuously, then this condition is known as ventricular tachycardia. If so, this indicate if we are not treating properly the BPC, then it is converted into ventricular tachycardia. And similarly, ventricular fibrillation, same as the atrial fibrillation, there is the number of many ectopic foci present in the ventricular muscles, and each and every ectopic foci which is present in the ventricle have initiated the electrical impulse. So there is the no fixed pattern of the P or QRS complex, and this ECG make a not sense of the any ECG. So if there is the cannot be interpreted, then this may be clue of the ventricular fibrillation. Now come on the conduction delayed or disturbance in the conduction. So as discussed in the earlier, all the atrial impulse pass to ventricle by the AV node or bundle of his. If any delay in the conduction of impulse through AV node or bundle is up to the ventricle, this shows the atrioventricular block or heart block. On that basis, the AV block or heart block may be classified into three types. First one is the first degree heart block. Second one is the second degree heart block. Third one is the third degree heart block. In first degree heart block, all the atrial impulse goes to ventricle, but there is the delayed, means the electrical impulse which is generated from the atria and stay on the AB node and required some time to spread on the ventricle. So in this type of heart block, the sinus is rhythm is sinus, means each P wave has the QRS complex, and each QRS complex is followed by the T wave. But there is the difference is the PR interval is very long. So in this ECG, this is the PR interval. PR interval start from the start of the P wave and end at the start of the QRS complex. So in normal condition, this is the 5 small walks. So in this condition, this is the PR interval is the large. This is belong from at that place to this place, almost 2 large walks. So in first degree heart block, the rhythm is sinus, but there is the PR interval is increased. But this is the constant. This increased PR interval is the constant for the each cardiac cycle or for the each wave. Now, second degree atrioventricular block means in this second degree AV block or heart block, some atrial impulse pass into ventricle or some atrial impulse not pass up to the ventricle. On that basis, the second degree AV block may be classified into 2 types. First one is the Mobius first type or Benkiewicz, or second one is the Mobius second type heart block. In case of Mobius first type heart block, the PR interval is progressively lengthened and until the P wave is not conducted. Means in first type of Mobius first type, second degree Mobius first type heart block, the rhythm is not sinus. Means there is some P waves are absent in the ECG and PR interval is progressively lengthened. Means the PR interval increasing in each wave, and after some time there is the no P waves, and this absence of the P wave indicate the second degree heart block. In case of Mobius second type of heart block, the PR interval is constant and PR interval P waves are intermittently blocked. So most of patients with type second block have the wide QRS complex. So this shows in the ECG finding. In case of Mobius first, this is the P wave, this is the QRS complex, this is the T wave. This is the normal but increased PR interval. And similarly, this is the P wave, this is the QRS complex and T wave. Similarly, PR interval is the enlarged. Same P wave, QRS complex, T wave. And this is the P wave, but this P wave does not have the QRS complex. Means the atrial impulse not conducted to ventricular. So when there is the not impulse reach to ventricle, then there is the no QRS complex. So this is the increasing the PR interval, and after that there is the absence of the QRS complex. In Mobius second type, the increased PR interval, but it is the constant, and there may be no fixed pattern of the ventricular P block. Ventricular not conduction of the atrial conduction at the ventricle. So this is the wide QRS complex, and this is the T wave, this is the P wave QRS complex, and T wave QRS complex, and after T wave this is the P wave, but there is the no QRS complex. So this is the second type of second degree heart block. Now this is the last one, is the third degree heart block or complete AV block. In this heart block, all the atrial impulse not reach to ventricle. So in this type of AV block, their regularity is the irregular. There is the difference between the number of P wave and QRS complex, and the PR interval is constant, but QRS complex is wide. And in this heart block, there is the atrial impulse not reach to ventricle. So there is the difference between the number of P wave is more as compared to number of QRS complex. Now, what are the limitation of the ECG? When we discuss the limitation of the ECG, then ECG does not provide the prognosis during the anesthesia or surgical procedure, and ECG does not give the in case of cardiac enlargement. ECG does not provide the value of the how much ball is thickened of the atria or ventricle, and ECG does not provide the information about the diseases of the heart valve and pericardium, and does not provide the obstructive blood flow diseases. And there may be wide variation between the breed and dogs of the different body conformation. This also we make the difficulty for the interpretation of the ECG. Now, conclusion of the today webinar, as discussed in the introduction, the leading cause of the small animal, leading cause of the morbidity and mortality in the small animal is the cardiac disease. So cardiac disorder have the significant threat to any canine population, as discussed, as going unnoticed due to lack of awareness among the owner among the even some clinicians. By increasing the awareness and utilizing the valuable diagnostic tool like electrocardiography and other appropriate investigation like biocardial investigation of the cardiac biomarkers or echocardiography, can improve the early detection and early management of the cardiac disorder. And this early detection and management of the cardiac disorder improve the quality life or length of the life of the affected dogs. And thank you. This is the presentation on the significance of the electrocardiography in the clinical diagnosis of the cardiac disorder in the canine. Thank you, everyone. Hello, Dr. Amit.
Yes, sir. Yes, sir.
Any query from participant side?
If any participant have query regarding the topic of today's resource person, so he or she can ask directly from him. Okay, sir. I don't think any participant have such type of query, sir. So after end of your lecture, sir, I would like to convey the thanks, sir. Thanks for sparing the time with our participants and for delivering such a nice lecture. I think all the participants will definitely benefited by this valuable lecture. Thank you, sir. Thank you once again, sir.
Thank you, Dr. Amit, for giving this opportunity to me to interact with the participant all over India. Thank you.
Yes, sir. Our pleasure, sir. Thank you, sir.